Hello guys, welcome to my channel again. Today I'm going to be talking about an overview of pathways to medical practice in Canada. I received many messages, texts, emails from people all over the world, especially from Africa, Nigeria, asking for like an overview of how to come over to Canada for medical practice. So I'm going to just be discussing the pathways that are available and give some tips and just describe what is available at this time. Okay, so in our usual way, I'll be going through some slides to guide us. Um, so just give a bit of an introduction, talk about the three pathways that are really available. That's the residency through the Canadian Residency Matching Service, that's called CAMS, and the practice ready assessment route. And then there's a route with people who have trained in approved jurisdictions. So in form of introduction, there are some myths and facts about practicing in Canada. One, some people say it's impossible, and that I'll absolutely tell you it's not true. I'm presently a general surgery resident at the University of Toronto. And some people say it's too hard, and that will be dependent on how much you are willing to put how much work you're really willing to put in. It is competitive, and that's true, and it can be quite expensive. My general advice for anyone who's looking into practicing in Canada would be to be proactive, have a lot of information at your side, research a lot, plan ahead. You gotta save money because it can be very demanding on your finances. And that's what I say, shoot on all cylinders, just try everything as you can. When I was trying, I tried most of the different routes, and I was fortunate enough to get my desired outcome. So the first pathway is the residency pathway, and that's through the Canadian Residency Matching Service. It's for those who have not done any postgraduate training from wherever they have been. And the best resource for this would be maybe review my other video. I'll put the link in the description below. And it's a pathway to full licensure. You can practice in any of the provinces. It goes from 2 years for family medicine to almost 7 years for like neurosurgery. There are positions that are available for international medical graduates, quite competitive to get, but the process is it's a year long. You get letters of reference, you get your documents source verified, and you put in your application, and then you be invited for interviews. So more of those details I've already dealt with in my video about which is I matched. So I wouldn't talk much about that pathway. In the practice ready assessment pathway, this is really for international medical graduates who have had some training and who have completed training, either in general practice, family medicine, or any of the specialties. And the whole idea is that you can be considered for a provisional license after a period of assessment, and the assessment consists of a supervised practice and then an assessment period. The provinces presently participating in the PRA are Alberta, British Columbia, Manitoba, Saskatchewan, Newfoundland, and Nova Scotia. It's actually more open to family medicine than the other specialties, because there's a great need for family physicians in many of the rural parts of Canada. And being able to get one of these positions usually leads to a return of service agreement in parts of Canada that are less served. And the requirements would be that you're a medical graduate, meaning you're already a doctor, and you've had up to 2 years of GP training. If you want to go through the PRA for specialty route, you would have completed postgraduate training in that specialty. But as I said, that is not usually very available. It's more available for general practice / family medicine. And this postgraduate training in general practice of family medicine should consist of some time in obstetrics and gynecology, pediatrics, surgery, medicine, and very importantly, psychiatry, which is one thing that many people who do internships or some form of postgraduate training in general practice complain about, because they don't do a dedicated psychiatric posting. And many of the provinces also require about 1 to 2 years of independent practice as the most responsible provider. So that is also very important. So whatever position you are in whatever country you are, if you're looking to the PRA route, try to find a way to get postgraduate training. Like in Nigeria, the house job, which is also called an internship, can be accepted as a postgraduate training, but that's only 1 year. And many of the provinces, except for Manitoba, accept 2 years minimum. So if you can get this postgraduate training, you should before coming over to Canada. And the internship that is done before you get the medical diploma does not count. So it has to be an internship that's done after you get a medical diploma. And then you can stay around to do a couple of years of independent practice before eventually moving over. And there are several provincial programs for the PRA, and they are a bit different, slightly different in terms of the provinces. But the general view is that you're going to this is a screenshot of the website. I'm going to put a link below. You would, as I said, get training experience for 1 to 2 years. Make sure it includes psychiatry, have some independent practice for up to 2 years, and you have to have currency of practice. Currency of practice means that at the time you are applying, you shouldn't have been out of practice for more than 3 months, usually. More than 3 years, usually, from the last time that you practiced. So usually many people who migrate to Canada while waiting for the exams, waiting for the process, eventually lose the currency of practice. And many people have had to go back to their home countries to update this currency of practice. And the process is that you apply for source verification of your documents as the SVR process with the Physician Apply website. And then you attempt the CCQE 1, that's the Medical Council of Canada Qualifying Examination 1. And you have to have a superior performance in the NACOSKI, that's the National Assessment Collaboration or skills exams. The QE2 has been cancelled or abolished. So in the past, it used to be QE1 and QE2, but now they accept NACOSKI, but generally not just a pass would be adequate. You would need to have a superior performance depending on the province. And then after having all of that, you then apply for an assessment of your medical credentials as the AMC to apply for the PRA. The PRA processes, as I said, are slightly different in the provinces. So I'll put the link down below so you can access each of the websites and you follow each process for each of the province. And you need letters of references from the people you've worked with, especially in your last independent practice. And then you would also need to describe your scope of practice, like what you've been able to do independently. So if you've had specialty training that is not family medicine, sometimes it is a plus if you are looking into a PRA for family medicine, especially for those who have had obstetrics and gynecology training or anesthesia training. It can be a plus. Doesn't mean you cannot go through the PRA route for family medicine, but you have to show evidence that you have up to 2 years of general practice, postgraduate training, and up to 2 years of independent practice too. In Manitoba, you may be able to apply with just 1 year of postgraduate training. That's the MLP-IMG program. So this is just a screenshot. So many times the PRA, like in Alberta, is split into two. There's a preliminary clinical assessment, and then there's the supervised clinical practice. So the third pathway, that's the approved jurisdiction pathway. It's open to those who have completed postgraduate training in countries that Canada recognizes as having equivalent postgraduate training as theirs. And these countries are Australia with New Zealand, Hong Kong, Singapore, South Africa, Switzerland, UK, and Ireland. So if you're in any of these countries at this time, or you plan to leave any other country and you can't get postgraduate training in any of these countries, that might be a very good route to go. You go to that country, complete postgraduate training, and then you can just basically walk into Canada to start a practice. Usually for specialties, you would need to apply for an assessment of your training with the Royal College. Then when you get the eligibility, you can then sit the Royal College exam. Now, if you pass the Royal College exam for a specialty, does not automatically give you a license to practice. You will still then approach the province where you want to practice to give you a license to practice. And usually, so that would be at the provincial level. But for the family physicians and GPs, if you trained in any of the approved jurisdiction, you can start practicing without an examination, without a college examination, but you still need to have the QE1, and your postgraduate training will give you the ability to, or the eligibility to apply for a licensure in that province that you're planning to go to. And thereafter, you can start to practice without any supervisory period or an assessment period. This is different from the PRA. The PRA route, you get a provisional license, and then you're supervised over a 3 to 6 months period, and then you can work with a provisional license with a return of service. But for the approved jurisdiction pathway, you get a full licensure once you're able to prove that your training has been assessed and you pass the Royal College exams. So this is just a screenshot of how to obtain a license to practice in Canada. That is the approved jurisdiction route. And this is for the family physicians, and you can be eligible to get that without the examinations. These are just screenshots of the approved jurisdictions: Australia, Ireland, United Kingdom, USA. And this is just a diagram of those who have landed as permanent residents in Canada. Rather than waiting in Canada and losing currency of practice, losing years, it seems to be easier in practice and in theory to get a GP training position in the UK. So some advice would be to go to the UK, get a GP training position for 2 years or 3 years, and then come back to Canada with the approved jurisdiction pathway. So quite short video. In summary, information is your best friend. You have lots of information available. Several videos, several YouTube people have YouTube videos address many of these routes. There is a lot of information. You can even send emails to the Medical Council of Canada for clarification. You can reach out to the College of Physicians and Surgeons of whatever province you plan to practice to get clearer pathways or clarifications on what is required. And my advice would be to sort through all this information, maybe get a big notebook or some file where you can, identify what you need to do, the deadlines, the milestones, and make sure to plan ahead. So I'll put these links in the video below, and you can put questions that you want me to address. If you want me to make any other video, I will work on that. So make sure to subscribe. Until next time, bye.